Today we're going to be talking about how to heal sciatica in 30 days, so stay tuned. Hi, I'm Dr. Nick. I am here with Functional Movement Therapy, and I'm looking forward to helping you to understand this problem so that you can move forward with a pain-free life once and for all. Everybody asks and wants to know, how can I heal sciatica? How can I heal my back pain? How can I stop this pain that is running from the lower back down through the center of my hip and down the back of my leg? And if that's you, I've got some great tips for you today, and I want to make sure that you understand the problem so that you can move forward with a real game plan for healing and what that step-by-step process should look like. If you're not a member yet, go ahead and join the Back Pain and Sciatica Support Group on Facebook. When we're talking about sciatica, we're really talking most often about a disc herniation. This is the back of my spine here, right? This is my tailbone, and these are my hips here on either side. You've got your vertebrae and you've got your discs here in between, and if we look at this canal here, this is the spinal canal. So it's about a pinky width wide. It's not very wide at all. You're talking about a couple millimeters there of space. So when we have a disc herniation, most often it occurs in that back portion of the clock here. So from side to side, coming back into the back central or back and lateral to either side. And that can be really indicative of what type of symptoms you're feeling. Are you feeling it, really across the lower back and really radiating across the lower back and into both hips, or are you feeling it more to one side? For instance, if this was coming out back into the left, then we would feel it more here on this left side of the hip. So once we understand that we're dealing with a disc issue, it's really important to know then what your direction of preference is. And that's step number one, is understand your direction of preference. Can I find the best position for me, and do I know whether it's standing, sitting, or walking? Which one are you? Go ahead and comment below with which one feels best, and when you notice that your back feels best, that your symptoms feel best. Most people will respond to the walking. They're going to feel best as they're going through motion, as they're going through life, as they're staying mobile to a point. And so if you respond to walking, you might have a directional preference of extension. Going through a range of motion test can tell you a lot about the way that you're going to respond to treatment. So if I move back and I'm going to about stretch, wherever that may be for you today, and I repeat that a few times, do I notice that symptoms move up or lessen in the leg? That's really important to know. So if I respond to walking, do I also respond to other extension-based movements? If not, that's okay too. That's just more information that we need to move forward with. But if I can find the direction and activities and positions that help me to move that pain out of the leg and back up to the spine, well, that can be really, really powerful. That means that I can feel better with movements and not necessarily having to ice all the time or medicate all the time or go into the next appointment even. That I have a basis, a foundation for healing, and I can do that often and I can do that quickly. Step number two then is going to be to stabilize. We talk a lot about core strength on this channel and in these pages, and I want you guys to understand that the transverse abdominis, it's the deepest core muscle here that wraps around the abdomen and all the way to the spine, is the only muscle that wraps around and really helps to support the spine on both sides. So it kind of acts like a corset around the abdomen here and supports those spines, the spinal discs. So if I squeeze those discs this way, right, inside and outside, then that disc is going to get a little bit taller. And if you notice how wide, or how much space, we talked about that pinky width for the spinal canal, buying yourself a millimeter at each level adds up to quite a bit of space, and that's the kind of support that we need. So we get really attuned, really accustomed to using this muscle, not only in our exercises, but we have to intentionally then take it to function. We have to take it to the way that we are doing the dishes, take it to the way that we are sitting at our desk, take it to the way that we are, activating this to pick up the laundry or pick up our children, especially if we have a physical job. Then these motions, these functional movements become so essential. So once we've stabilized that TA and got everything starting to work together, now our functional movements become the way that we go through life and utilize our body. So the big 5 functional movements that we teach here are a squat, a lunge, a deadlift, a split stance deadlift, and a single leg RDL, which can help you to complete the task that everyday life requires with a neutral spine as you're bracing and protecting that lower back. And that allows that disc to heal, because the disc is avascular, which means that it does not get a direct blood supply. And so that just means that it doesn't mean that it can't heal, it just means that it takes a little bit longer to heal. And so we want to give it time, be patient, and respect that healing process. You guys know that if you were to, cut a finger here, it's going to take about a week for that scab to come on, for the scab to fall off, for the skin underneath to grow back and mature. For most disc injuries, it takes somewhere between 2 weeks to, a little bit longer, depending on the severity of the injury. A great rule of thumb is the further down the leg that pain goes, the worse it is, and the longer it's going to take to heal. Going back to those functional movements, we need to master those hip hinging patterns, we need to master spinal stability and spinal hygiene in order to be able to move forward. Spinal hygiene is the idea that we want to make sure that we're not, doctors talk about no bending, no lifting, no twisting from the lower back. So we want to make sure that we're hinging from the hips, not bending from the lower back. And there's subtle differences here, guys, but they're so important. When we bend from the hips, our hips can lead the way, and my pelvis can stay steady as I move through that range. When I bend from the back, you guys can see just this little bit of excessive flexion going on here. My hips are still coming back a little bit, but I'm really doing the motion from my lower back, right? That's where I'm going to feel it, and that's where that stress is coming from on an already injured area. So we need to be very mindful about that. The old adage was lift with your legs. Honestly, that's just poor advice, because that doesn't tell us anything about the spine. It doesn't tell us anything about stabilization or breathing or how to really set ourselves up for the lift properly. So functional movement teaches those nuances of movement that are oh so important to healing. If you want to learn more about that, if you have questions about any of that, go ahead and comment below or tell us what your light bulb moment was today, so that we can help to create more content for you as we move forward with this channel.